All right, welcome to our self-advocacy series, Self-Advocacy 101. Core concept of self-advocacy is that empowered patients receive higher quality care, and we'll talk more about that during this session. First question is, who knows your body best? Audience, who knows your body best?
I'd say that we know our body best.
Does everybody agree?
Yes.
Yeah.
I agree.
Yes, you are 100%. You know your body best. You know how your body feels, anything that has changed, how your treatments are making you feel. Your doctor knows, and when we say doctor here, we're using doctor in the broadest definition of the term. This is nurse practitioners, physician assistants, therapists, psychiatrists, anybody you talk to receive care when we say doctor. Your doctor knows what your labs and tests say about your body. They know how your condition can make people feel. They have that medical expertise. They also know how you're likely to react to treatments. It's very important to work with your doctor so that you both understand your body. This is one of the real key concepts of shared decision making. And we'll talk a little bit more about shared decision making later. But shared decision making is actually a formal model that is now in use really throughout the country in many institutions where patients and doctors have an equal voice in all decisions that get made. So the second part of this is, what is your doctor not?
Mm. Hmm.
Could you elaborate more on that question, like specifically? Like,
Sure, we have a lot of expectations of our doctors and what they can do. And this can be a real challenge. And actually, it's often that people don't quite know what to make of this question. So let me go ahead and just put the answer out there. Your doctor is
Yeah.
not,
Mhm.
Yeah.
Yeah.
I
and
I also I also think too, like they're not like they can't read the future. Like they can't tell the future either.
no, they can't. They're also not a clairvoyant to be able to look into the future for us either.
Hmm.
Absolutely. And this actually, unfortunately, for many providers, what they run into is an expectation from patients that the doctor should just know what's going on. And unfortunately, this really isn't possible.
Hmm.
Your doctor can't know how you're feeling unless you say something. You have to tell the doctor what's going on. This part is really especially important. This notion about treatment goals. Your doctor
Hmm.
can't know what your goals are unless you tell your doctor what you want to get out of treatment. You have to decide what matters to you. And this is different for everybody. Even for yourself, it will be different at different points in your life. What your priorities and goals are when you're 18 or 19 or 20 or 30 or 50 or 70 are going to be different.
Hmm.
And it's up to you as the patient to let your doctor know what you want. And there are some real specifics here that are really important to think about and to communicate with your provider about. What are your priorities? What matters to you? What do you want to get out of a treatment? What do you want to achieve in your life? What do you need to be happy and satisfied? So I'll put it back out to the audience a little bit. What are some of your treatment priorities? When you think about managing your condition, what
Hmm.
are you seeking to get? Let's get a few examples.
I guess for me, as a person with diabetes who takes round the clock insulin, I guess one of my highest priorities is having an insulin that uh, works for me and works for my devices, my insulin pump. And second to that, I'd say the next priority is having a clinician that understands those numbers, and understands how to adjust my ratios and so that I can be within range as much as possible because when I'm out of range, I don't feel too good. And feeling as best as I can is probably my top priority.
All right, so you just define something that's really, really important as a treatment goal, which is maintaining, I'm going to put it in different words, which is maintaining your quality of life.
Yeah, 100%.
So for some of you others, particularly some of you who are right at that transition point, having just shifted now from being a juvenile, being under the age of 18, to now you're an adult and you're managing lots of transitions. What are some of your goals? What do you want to achieve right now over the next couple of years? Some of you I know are in school. What are some of your priorities?
Um, I think for me, just being able to like know my body a little bit better and not pushing it past its limits. Because like specifically with NF, like at least for mine, like whenever I do push my body too far, like I do, like I'm in a lot of pain afterwards, and kind of maintaining a good balance while also like going to class and being able to graduate and that kind of stuff.
Mm,
Okay, so you just brought up a really important one for everybody who's at that transition point, which is going to school and succeeding and achieving your academic goals. How many people are headed into a job at this point?
mhm.
Are you starting to think about careers and what you want to do once you get done with school?
Yeah.
Okay. Another one that, in terms of being happy and satisfied with life, this is true really for most adults, but certainly for somebody who's now entering into their early 20s or 30s, is what about starting a family? Is that
Mm,
something that you want?
mm,
So these are the types of things that we think about when we think about setting goals, about the things that we need in order to feel that we're having a fulfilling life and that we're achieving the things we want in life.
mhm,
There are many, many other things that could be on that list. There's lots of different ways to structure your goals.
mhm,
One of the things that's a reality in working with any form of treatment for any condition whatsoever is that there are risks to treatment and there
mm,
are very real side effects to the types of treatments we use. Certainly in the NF world, we've been very fortunate to finally have some approved treatments for plexiform neurofibromas, the MEK inhibitors, selumetinib and mirdametinib, which are, it's huge progress and it's wonderful that we have that available, but they can also be very challenging. So when you're working with your providers about setting your goals, you need to be clear about what do you want to avoid in terms of the risks you're willing to take and the adverse effects that you may very well experience. Your doctor can't know what you're willing to risk or tolerate unless you state the outcomes you want. So if you wanted to take a drug that would really interfere with concentration, maybe it would really help you, but it would really interfere with your ability to concentrate on your studies.
mhm,
You have to define what matters to you. I recently was talking with somebody who's a cancer survivor, somebody who was a very accomplished musician, and his care team recommended a drug that they felt really strongly would really help him and possibly even cure the cancer, and at the same time destroy the nerves running down to his hands. And he
mm,
made the decision that risk, that adverse effect was not worth it. and opted out of that treatment based on what his treatment goals are. And so that's something that's really, really important for us to talk to our care team about, because our doctors, in fact, they can alter and shift the treatment recommendations based on your priorities. But again, they're not a mind reader. They have to know what your priorities are.
Mm-hmm.
One thing I can assure you is that your providers, good providers, truly do want to hear from you about what you want. We have a responsibility when it comes to the risks to be very clear, open, and honest with our providers.
Mm-hmm.
Never withhold information or lie to your care team about what you're experiencing. Never refuse to take your medications without telling the truth about it. So I'll throw another question out to this group. Do you know anybody who has not taken their meds, not followed the treatment recommendations, and didn't tell the truth about it? I see, Naomi, you're shaking your head. Do you want to make a brief comment there?
I had a friend who was also epileptic, and she went off to college and wasn't taking care of meds, wasn't getting proper sleep, wasn't taking care of herself, and she had a lot of breakthrough seizures and ended up having to go home instead of continuing her college education.
Yeah. This actually, unfortunately, is very common, and treatment non-compliance is an issue. And this is our responsibility as the patient. And one of the things that can be a challenge, and what is really, really important, is for us to communicate with our providers about how these treatments are working, good or bad. They're helping, they're not helping, they're helping, but it's a problem. The way this medication is making me feel is something I'm not willing to tolerate. So
Mm-hmm.
rather than refusing to take the med, or I've certainly seen patients who cheek their meds, palm their meds, pretend to take them and don't take them. All of those things can happen and do. And it's on us as the patient to be honest, to be open, to say, you know what? I'm just not willing to take this drug if it's going to make me feel this way. What are my other choices? That's
Mm-hmm.
on us. That's a really important part of managing risk.
Mm-hmm.
Here's the third question. Who is the captain of your care team? And before you answer, let me define what care team means. So care team means all of the doctors, therapists, nurses, advanced practice nurses, physician assistants, care buddies. If you bring care friends onto your care team, certainly for many of us, our family. Our family can be a part of our care team too. So all of those people need someone to drive and coordinate where that ship is going. Who's the captain of your care team?
Mm-hmm.
Unmuted.
You should unmute, yeah. Griffin has some reason. Oh, yeah.
Um, I say, I say that you are. Can you just? I say that you are because you're making the decisions. Oh yeah.
You are 100% correct. This is something that changes profoundly on your 18th birthday. You now become legally the captain of your care team. There are different ways this can be approached. Some people will fully assume control of their ship and be the one and only decision maker. There's other options. You can share that role of being captain if you choose. You can have a shared decision-making model with your parents, your guardians.
Mm-hmm.
Jen, would you like to talk a little bit about that option?
Sure. My son has more cognitive impacts than our other speakers here that I know. But yes, he is more in charge, but we have a shared decision-making model for everything for his life. So he is in control, but has certain trusted people to discuss things with. And I tend to be the one going to going to the medical appointments with him and supporting him. And there's sometimes, where it comes from either forms, real long forms with, consents and stuff. I'm reading it to him, or I'm reading summarized here. Here are the important things. So they're going to do this, that, or the other, or they're allowed to do this, explaining things to him. But yeah, he has final decision making, but we're there to help inform him and make sure he understands it before he decides.
Okay, and there's actually formal legal documents that can be executed. Remember, one of the things that really changes is your doctor cannot say a single word to anybody else without your permission after your 18th birthday. We had one of our families it was one of our diabetes families who talked about the fact that their son had turned 18, and the day after his 18th birthday, he needed his insulin, and they needed to go arrange with the pharmacy to get it. They called the pharmacy up, and oops, the pharmacy could not say a single word to them because their son had not signed that release of information that has to be signed.
Yeah, we've done that with all of his doctors and stuff, because I've asked him, I was like, do you want me to be able to help you out? Do you want me to be able to talk to the doctors or schedule appointments if you aren't able to right then, or if you're, worried about something else or other things? And he's like, yeah. So at each doctor, after he turned 18, we asked for a release of confidential information and that I could participate on his behalf, arranging some of the things and helping out. And yeah, also with the pharmacy and stuff. But yeah, it's true, because, we had to set up, new patient portals and stuff. So it was his, and then I was like attached to his, where previously it had been mine accessing all of his stuff. But yeah, that does occur, and yeah, it can take you by surprise. And then also, especially you guys are over 18, getting medical power of attorney signed over to your parents, like all of you have serious conditions. If something were to happen and you couldn't make decisions, it's not just necessarily mom and dad. You just can't. You need it in writing.
Yeah, I had that set up with our insurance company. So if anything does happen to me, my parents do have control over my medical. That's just something that we did agree with. My parents were very kind of clear cut about what that meant. And I felt just with my NF that was something that should be in the cards and something I should have access to because of how important I think my health is. And my parents know more about exactly what's going on and and what has happened leading up to me being over 18.
And
Excellent. Go ahead.
I just wanted to mention, in speaking about release of information, I think a lot of the stigma when I was younger and just transitioned to the age of 18 was the reluctancy of allowing my parents into those portals, because I felt like for some reason that there was an association between um, if my parents have access to my medical care, then that means that I'm not really as independent as I thought. And now that I have aged some and had more experience, and also I have good days and I have bad days, and I have bad weeks and I have bad months, um, there are at times where I just need somebody to lean on. And really, in truth, that's what I feel like it's all about, is having a parent or a loved one or a spouse who is able to pitch in and help. And so there's also a convenience aspect of it, is if you and your parents or you and your spouse share the same pharmacy or share the same dentist, it might be convenient for convenience sake to have mom and dad pick up everybody's prescriptions, or if mom or dad, or if you are going to be calling the dentist to set up appointments, you might want to set up the appointments for everybody in the household. So it doesn't always translate to you not being an independent person.
I also want to hop on with that is like, I feel like also just with turning 18 and signing those rights with your parents of them being able to help you out. I feel like a lot of people are like, oh, I'm losing my privacy. I think when it comes to medical and especially with having a condition, like privacy isn't always the best thing. I feel like being pretty clear on and everyone knowing what's happening is actually beneficial because like then if you do need help, like they know exactly what's happening and they can help you through those steps and help you make the decisions to get to where like your end goal is, as if it's a personal or a family kind of outline.
Y'all have done an excellent job of discussing and illustrating that while you are the captain of the care team and you are the ultimate decision maker, it's not something that you have to do alone. And even for us older folks, I also have a medical uh, authorization in for my son and sister, because there are times when I might need care or something may happen where I can't make my own decisions. And so having that medical advance directive, having that assignment of somebody who can step in and act on your behalf is absolutely critical. And it's a very important part of this process.
Yeah.
Okay, so let's talk a little bit about what this means now that you're an adult, now that you are the one who ultimately is making these decisions. The doctor's job is to advise and educate you about your health condition and consult and make recommendations about your care plan. The patient's job is to learn about your health condition so you can make good decisions. It is both your responsibility and your right to make the decisions about your care team. Heavy emphasis on it's your responsibility to make that decision. Your job as a patient, going back and reviewing this a little bit, to be clear about your treatment goals, your risk tolerance, and what your treatment preferences are. Something that's really helpful is to let your doctor know about how you prefer to receive information. There's not a right and wrong answer here. It's what's right for you. Some people prefer the facts, the details, the statistics. They want to know the underlying science and why are we making this decision. But that's not for everybody. Some people just want a real general summary of key points and would prefer simply to rely on your medical provider's expertise. They don't want to know all the science, but you have to be clear with your provider about your preference. Ultimately, you're the only one who can make the decision. Doctors write orders for you, but they don't give you orders. It's your decision to make. Okay, we talked a little earlier about shared decision making. Shared decision making is actually a formal model of medical care. And the key of it, it is about collaboration. It's on us as patients to communicate clearly. It is on the doctor and our other providers to listen to us and hear us. Working together, the doctor and patient make good decisions based in a relationship of mutual respect. There are some things you can do to make this process work. Use your doctor's time wisely. Doctors are frequently back to back to back with patients, and we need to work efficiently. Your doctor wants to help you, so help your doctor help you. One of the things that is really helpful is to go with a written list of questions, concerns, symptoms, updates when you go to your appointment. Bring it in writing. I strongly recommend to everybody that you come with a formal written agenda for your appointment. It's something that you can have a copy for yourself and provide a copy to your doctor to help structure your appointment. We have a whole additional training that's specifically about how to write an agenda. And that will be available to you on the site, and as well as hard copies if you request them. Bring a written list of all your medications to every single appointment. This is really, really important. I almost always have to make changes to what's in the My Chart, which is for those of you who use My Chart, it's very common for your medication list at your doctor's office to not be up to date and accurate. So if you bring a written list, you can make sure that the doctor's making decisions for you based on accurate information. For those of you who are kind of newer to managing your own medical care, is you almost always are going to have to provide your ID, your driver's license, and your current insurance information. That's now on you. Your parents aren't going to be there with you to do it for you. So you have to do it. Make sure that you bring that information.
Mm.
Okay, we'll wrap up by just going back to the real keys. Effective self-advocacy is based on educating yourself about your condition, asserting yourself, and collaborating with your care team, using that shared decision-making model. It isn't always easy, and it isn't always easy to be assertive in a doctor's appointment, but it still rests with us to do that. Empowered patients will always receive higher quality care. So thank you, everybody, for participating. Very happy to have you all here. Look forward to seeing you in the future and hearing more about how managing care is going.